Welcome back to This Week on Staten Island. I'm Anthony Pascal. We are going to switch gears now and talk about the impact of Hurricane Sandy. Not the loss and destruction of physical property, rather the mental health effects. Since the storm hit, the Staten Island Mental Health Society has provided crisis counseling for hundreds of victims of the storm. And joining me now to talk more about their efforts is the organization's president and CEO, Fern Zagor. Fern, thanks so much for being with us.
And thank you so much for having me here.
Let's talk about first the issue, the mission of the Staten Island Mental Health Society.
Yeah. Staten Island Mental Health is an agency that's over 100 years old. We're all about children and families. We provide a wide range of services to the children and families throughout the borough. Every year, through our various programs, we see over 5,000 people. That's 10% of the agency's population. We have mental health services, substance abuse for teen and their families, developmental disability services, early childhood intervention, and early childhood Head Start programs, as well as a number of support programs throughout the agency. Our goal is to help children and their families function in the best way possible and provide supports in whatever way we can.
So you have a lot on your plate, and then comes Hurricane Sandy, and now you're dealt with hundreds, maybe even into the thousands of people that now need your help more than ever. And how do you respond?
You know, this was unprecedented. No one was prepared for this type of disaster. We immediately went out into the community to reach out to families and children. Our staff went to evacuation centers, schools, community centers, wherever there were gatherings of people, and offered what help could be found. But the truth is that very few of us knew what to do at that point in time. Within the first few weeks, we began to meet with others in the community and to try to form a plan. Where are the needs? Where are the gaps?
So what were the immediate needs?
Well, most of the efforts were around stability, what I call bricks and mortar. You know, how do we make sure people are safe? Do they have what they need to survive? But it became very clear that what was interfering with people's ability to make decisions for their daily well-being were the emotional responses, the immediate emotional responses they were having to this disaster. We began to send our counselors out to do crisis counseling, to help people understand that some of what they were feeling, some of what they were experiencing, are normal reactions to a very, very abnormal situation.
So what types of reactions are we talking about?
Well, the sorts of things that people would say, whether they were very nervous, they were panicky, they were afraid that this would happen again. Most people couldn't believe that it was true, and a lot became immobilized, meaning that they had difficulty planning the next step. What do I do now? They just felt so overwhelmed. We spoke with the children who come to our services and the children who are being seen in the community. And remember, that's our expertise, children and their families. And some of the stories we heard were just chilling. For instance, we spoke with an 11-year-old boy who described being in his home during the flooding, and he and his family escaped up to the attic of their house, and the waters kept coming up higher and higher, and finally it reached their necks. He described very graphically that the refrigerator was floating by. They put their dog on top of the refrigerator, and they really weren't sure whether they would survive. They were in water from 8 at night to 5 in the morning when the National Guard came to save them.
Wow.
So I asked him, is there anything you worry about now? And he thought carefully and he said, you know.
How old is this person?
About 11.
Okay.
He said, well, I worry that every time I hear the rain outside, I become very scared. And then he thought a little bit more and he said, I don't think I'm going to be able to swim this summer. I can't go into a pool.
And I'm sure that's the case for a lot of young children.
Yeah. Another young lady told me about nightmares and flashbacks. She was in her home and she was watching out the window and saw a neighbor drown. She's not able to go back to her home. The home is completely destroyed. And she keeps thinking back to that night, and it didn't happen to her, but so frightened that it could have, and then having this picture of her neighbor drowning in front of her. Those are the things that we're hearing when people are asked to talk about what their feelings are, what their thoughts are, what their worries are.
So what is it, as a counselor, are you able, to try to get these, how do you make it better, I guess?
Post-traumatic stress is something that doesn't necessarily present itself immediately.
And is that what we're talking about? These people are all, diagnosed with post-traumatic stress disorder?
There's a continuum.
Mm-hmm.
There are normal reactions to these types of very abnormal situations. You would expect that people will feel overwhelmed, that they would have a hard time making decisions about the next steps, that they would feel anxious and nervous. So the short-term crisis counseling, and we get support for doing this from the Office of Mental Health, from some private funders. We've had help from the Federation of Protestant Welfare Agencies, from the United Way, from the Robin Hood Foundation. Crisis counselors will move in very quickly and let people know that what they're feeling is expected. And by talking through what they're feeling, what they worry about, they're helped to make plans and see that there are steps that they can take to help them move forward. That's the crisis counseling piece. But there's about 20% of people who really can't move beyond that crisis, and for whom these kinds of reactions, nightmares, flashbacks, overwhelming anxiety, becoming immobilized, inability to make decisions, these sorts of issues begin to interfere longer term
But how do you
with
help
their daily
someone
lives.
with that?
So that's when they need more focused mental health treatment. And there are evidence-based practices that have worked in helping people with post-traumatic stress. So we've partnered with Save the Children. Save the Children has developed some approaches that they developed in New Orleans after Hurricane Katrina, called Journey of Hope and Care for the Caregivers. Our counselors have learned these approaches and are using them effectively with children who have been impacted and with the adults who are trying to help themselves and help others. Cognitive behavioral therapy is a very, very effective way of helping people with post-traumatic stress. These approaches are not short-term, they're longer-term, because the impact has a longer-term effect. Post-traumatic stress can show itself in 6 months, a year.
Right, so it's
even
true
2.
that some people may not even realize that they have it yet. It may show up months from now.
That's right. That's absolutely right.
So what's your advice to people that were impacted by the storm, that think they may have some lingering effects, and it may, if it does get worse, what's your advice to people?
It's very important that people understand that what they're feeling is real, that they don't try to minimize it or be angry with themselves for having these feelings and say, I shouldn't be feeling this way. They feel what they feel. They worry about what they worry about. And it's important to seek out mental health professionals who can help them determine the best way to approach whatever it is they're feeling, and help them plan more effectively further on in life. And what we also know is that if at this moment in time they're not effectively helped in dealing with the current trauma, there'll be a trigger later on in their life that will remind them of this current trauma, and they won't have the coping skills, the resources to be able to act effectively.
And that was going to be my next question, is what happens if PTSD is not treated?
So it's a great question, because people don't realize that problems they may be having much further down the line may be as a result of the trauma that they're having now. So it may affect their relationships, their ability to work, be successful at work, or be successful in school. Something in the future may trigger off the feelings, the experiences that they've had now. Another interesting example, through our crisis counseling outreach, we were speaking with a fellow who's in his 60s, I guess, and this trauma reminded him of trauma in Vietnam because he's a Vietnam veteran. It's something that he hadn't thought about in all this time, and he's finding himself having flashbacks, having inability to concentrate and to plan to move forward. So today's trauma triggered off yesterday's.
And hopefully, these people, it's a wake-up call to get some help and talk to somebody about it. Right. My last question, you're a nonprofit organization, as are so many on Staten Island that are helping people cope with the relief from Hurricane Sandy. How are you when it comes to being able to handle things financially? Where are you at capacity?
Okay, that's absolutely a wonderful question. As I said, we've been an agency that's been around for over 100 years, and we are always at capacity. Treating the people and helping the people that we usually do. Now the whole community is our client, and so it's stretched our capacity tremendously.
Will you have to turn people away?
We never turn people away. We do what we can, but we've been working very hard to get supports from charitable organizations, Tiger Foundation, Robin Hood, Save the Children, Federation of Protestant Welfare Agencies, United Way, and we're seeking help from wherever we can get it because we don't want to turn anyone away. But it is stretching our resources tremendously.
Well, it's great work that you're doing. Continued success with helping the people that need it the most, and hopefully that help that you guys need will be there in the future. Fern Zagor, the President and CEO of the Staten Island Mental Health Society. Thank you for being with us.
Thank you very much.
Okay, we are going to take another break. We're back with our Staten Islander of the Week. That's after this. Stay with us.